Well, the Young Nurses Indaba trade union is fighting what it says are austerity measures in the health sector. The union will be marching to the Department of Health and National Treasury this in Tshwane to hand over a memorandum of demands today. So for more of this, Rich Sicina from Young Nurses Indaba trade union joins us to give us a clear indication of what they'll be doing there. Rich, good to have you, and good morning to you. We understand you are planning actually this morning to take your march to Treasury as well as to the Department of Health officers to hand over a memorandum. But what's inside this memorandum? What are your demands?
Good morning to you, my sister. Good morning to the viewers at home and all our NETU members. We are saying Amandla. We are going to National Department of Health and National Treasury. Remember last month on the 16th of March, we went to Gauteng Department of Health. Then we've been working hard on the ground, and we have realized all head of facilities like CEOs and HR managers, they are actually saying, we need to. You are complaining about gross shortage of staff and gross shortage of material resources. The department is falling apart. The public healthcare system in particular, it's under siege. The problem is funds. We do not have money. We would actually like to close those gaps and hire all those COVID-19 contract workers, community service professional nurses, in-source securities, but we don't have money. That is why now we are saying, let's go to the monster in the room, National Department of Health and National Treasury. All our demands are more or less similar to the one we sent to Gauteng Department of Health, but this time around we have added to say we want to do away with austerity measures. We believe it's just an insult and unfair to black poor people in South Africa who are beneficiaries of the public healthcare system. Pants in the austerity measure, pants.
You're also saying this, Mr. Sicina, because you're accusing, government of actually contributing to the worsening conditions of the working class and the poor who depend on these services. Paint us a picture of how the healthcare system is looking right now with these austerity measures in place.
It's a complete mess. It's a complete mess. I have there's a hospital I visited. I visited a lot of hospitals in KZN, even here in Gauteng. I was actually greeted by buckets and blankets on the floor. There is a pediatric unit that I visited at the hospital in Pietermaritzburg. Our hospital are dilapidated. The shortage of staff is worse. I was speaking to another professional nurse 2 days ago who's working in a neonatal ICU here in Gauteng. And this professional nurse was the only one on duty, nursing more than 20 neonates. One professional nurse and one enrolled nurse. That is what we are facing. As a result, we are saying, yes, we are defending jobs. We want nurses to be employed, not only nurses, but all healthcare professionals. We are talking about insourcing of security services, but we are defending the healthcare system. It's a complete mess. As a result, as Young Nurses in the trade union, we've even said we are tired of this government using us, nurses and doctors in particular, as accomplices of murder. We actually go to our line of duty knowing that there is a person who's going to die. Not because we are lazy, not because we don't have expertise to save that particular person, but because it's humanly impossible to save all of them.
But what is the Department of Health saying to you in response? Why are they allowing for shortage of staff in these hospitals, in these clinics? Why are they allowing nurses, like you've mentioned just now, attending to 20+ patients at a time and not assuring that, of course, enough staff obviously can be able to assist where capacity is needed? Have you engaged with them? Have they given you a response? What is their response to their reasoning behind cutting back and cutting costs?
Their reasoning behind cutting back and this the cutting costs or these austerity measures is they are crying poverty. Truly, they are crying poverty. As a result, we have actually concluded that it's because they don't care. They actually don't care. It is because they are not beneficiaries of the public healthcare system. When they are sick, they are not going to go to Bara. When they are sick, they are not going to go to Prince Machine in the public healthcare system and experience what is happening. When their neonates need admission, they are not going to go to those overpopulated neonatal units in our facilities. That is why they actually don't care. As a result, we are saying, if you cared, you are not going to implement austerity measures against public healthcare system or healthcare system in general. It's because they have failed dismally. That is another message that we want to send out there, that should we submit this memorandum of demands, but we don't get that desired answer, then the public should know that we are in for a high jump. We have serious chronic poverty of leadership in this country. There's no tangible reason besides them crying poverty against Department of Health. Come on.
All right, we'll leave it there, and I appreciate you speaking to us. Rich Sicina from the Young Nurses Indaba Trade Union talking to us this morning about an expected march, 9 a.m. Today, expected to take to the National Treasury and National Department of Health. They're handing over a memorandum there to, of course, government. They're saying they want their demands met, and they want the public to know that they're demanding, of course, their concerns to be attended to due to those dire, situations, circumstances that nurses have to work under right here in South Africa.